So you just went to a free health fair and they took your blood pressure and they told you your blood pressure is high and you're freaking the hell out. What is a high blood pressure, or as doctors call it, hypertension? Hypertension or high blood pressure is a very common disease. And yes, this is a disease. When I ask my patients, sir, do you have any history of medical disease or medical conditions? No. Anything that you can think of? Nah. And then I take a look at their medication and I'm like, so why are you taking hydrochlorothiazide, losartan, metoprolol, and amlodipine? Oh, I have high blood pressure. Seriously? Maybe because it's very common or it doesn't have any symptoms, people don't count it as a disease, but it is a disease, okay? If the blood pressure remains high for a long time, it can make you blind, it can give you heart attack or heart failure, it can kill your kidneys and make you go on dialysis, it can cause a stroke, quite frankly, it can kill you. So better take it seriously, huh? Now, when you go to your doctor takes your blood pressure, puts that cuff and pss, 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 or it's like a more fancy doctor who has a lot of assistants. The assistant will come and then put a cuff and then hook it up to a digital machine and then it starts squeezing your arm till your arm wants to fall off and it goes down and then tells you two numbers. The top number is systolic blood pressure, or the pressure of blood in vessels while the heart is contracting. The bottom number is the diastolic blood pressure, or the pressure of the blood in your vessels when heart is relaxing. The normal blood pressure is any number below 120/80. Also, just one measurement of your blood pressure does not mean anything, okay? If you go to your doctor, you smoked a cigarette before, or you took a cup of coffee and you ran around the block, your blood pressure might be like 150/90. That does not mean that necessarily you have high blood pressure. The blood pressure is designed to go up in certain situations, like when you're anxious, when you see the doctor's face, right? Well, not that the doctors are all scary. This is actually called white coat blood pressure, which means that you see the white coat, you freak the hell out and your blood pressure goes up. But anyways, in those situations, your blood pressure is designed to go up to cope with your body's needs. And it doesn't mean that your blood pressure is constantly up. How do we make the diagnosis? When we check your blood pressure in 2 separate visits, 2 weeks apart, and in both of those visits your blood pressure is high, then we tell you, hey, I think your blood pressure is high, so we should think of something. But how high is high? Any number from 120 to 129 over less than 80 is considered as elevated blood pressure. Now, it's not hypertension yet, but people with the elevated blood pressure are at increased risk of developing hypertension and cardiovascular disease, but they don't need medication yet. Any number between 130 to 139 over 80 to 89 is considered stage 1 hypertension, and any number over 140 over 90 is considered stage 2 hypertension. Now, why do you get hypertension? Well, essentially no one knows. In 95% of the time, the reason for high blood pressure is not clear, and that's why we call it idiopathic. Well, idiopathic is a word that when doctors can't find a reason for something or some disease, they call it idiopathic. I think it's coming from the word idiot. But anyways, so don't worry about why you got the hypertension, because 95% of the time, no one even knows. In 5% of the time though, for example, in younger people who get hypertension, sometimes we can find a treatable cause, like a problem in kidneys or a hormonal problem or something that might be treatable. Now, how is hypertension treated? Treatment of hypertension starts with lifestyle modification, things that you all know but you never do. Don't skip the video, okay? What you should modify in your lifestyle? It starts with changing your diet, and most importantly, to reduce the amount of sodium that you're taking, or the salt. Most of us are consuming more salts than our body needs, especially taking canned foods and processed foods. Now, those foods have a lot of sodium in it. By guideline, a low sodium diet means less than 2.4 gram of sodium. Okay, what is a 2.4 gram? Approximately 1 teaspoon of salt is about 2 grams, and this includes all the salt in your snacks and in your canned food and in your deli food. So basically, an easy way to reduce the sodium in your diet is to get rid of the table salt. What else should you modify in your lifestyle? Drinking less. Please don't skip the video. I didn't mean don't drink. I just said drink less. Which means that if you're using more than 2 drinks per day, well, first off, good for you, you're having a fun life. Secondly, you're at risk for hypertension and more cardiovascular disease. And if you binge drink, or in one session drink 4 to 5 drinks, you're at even more risk of developing hypertension. But you know what? Regardless of the hypertension, we should have some fun as well, right? But drinking every day is definitely not recommended. The other thing that you can do to reduce your blood pressure is to eat more fruit and vegetable. Now, this does not mean to go vegetarian or vegan necessarily, but just to eat more fruit and vegetable during a day. And I mean at least 4 to 5 servings of fruit or vegetable. Also, if you eat more fiber in your diet, it will help with lowering your blood pressure. Basically, fruit and vegetable has a lot of fiber, but you can find fiber in other products like breakfast cereals, beans, and grains and stuff like that. Also, eat more fish and seafood. This will will help reducing your blood pressure. Another thing that can put you at high risk of developing hypertension is drinking a lot of coffee or the caffeine. Well, how am I supposed to live without coffee, man? Come on. I didn't say quit drinking coffee, but definitely limit it to 1 to 2 coffee per day. Another exciting things to do to reduce the risk of hypertension is to exercise. Now, exercising by itself, even if you don't lose weight, will decrease the risk of hypertension. By definition, it's 2 to 3 hours of walking fast, running, or strenuous activity per week. Doesn't seem much, but please look back to your last week. How much exercise did I do? Well, watching a movie, playing games. Guess what? 0. Another thing that's very important in treating your hypertension is weight loss. If you have a body mass index or BMI more than 25, you're considered overweight. And if it's more than 30, you're considered obese, which puts you at very, very high risk for cardiovascular disease, hypertension, and diabetes. Well, I basically told you to quit whatever fun you've been having, but wait, it doesn't stop there. Quitting smoking and illicit drugs is also recommended to treat hypertension, meaning that a lot of drugs like marijuana and cocaine directly increase your blood pressure. Now, what if you did all these things, which to be honest, I don't think anyone can. I mean, what if you did part of these things and you still have high blood pressure? Well, that's the time you come to the doctor's office and we will give you some medication. When you're started on a medication, it's very important to take it every day. It doesn't mean that you take it for a week and then your blood pressure is treated. Hypertension needs to be under control for a long time. Once you're started on a medication, then your doctor will monitor your blood pressure and check how is it controlled. In the next visits, he may increase or decrease the dose of your medicine or change it to another medication if you have any side effects. They may also add some other medicine if they can't control your blood pressure with one medication. It's also recommended to buy your blood pressure machine for home. It's not very expensive. In fact, let me Google it. Yeah, I gotta go to Amazon. So you can buy it for $16, not even the price of a meal in a mediocre restaurant. If you check your blood pressure once or twice a week and you're sure you're keeping the number down, it can save you from a lot of disease and conditions in the future, and it can save your life. Thanks for watching, and if you found it useful, don't forget to share this video and subscribe to our channel.